Doctors can make decisions, but without diagnostic medication and supplies, those decisions go nowhere. Welcome back. Quick recap: in the last episode, we explored ambulance management, OT workflows, and CSSD, where emergency responses, surgical coordination, and sterilization come together. But once treatment began, another challenge takes over: getting the right tests, reports, medicines, and consumables to the patient at the right time. This is where most hospitals struggle with delays. Let's see how MediQuad handles it. This is the laboratory module. Every lab request and order is managed in one connected workflow. The moment you open any order, you see a complete visibility into the requests and patient details. And here's what makes the process faster. You can directly create an IPD sales order from the same screen by clicking Create IPD Sales Order. And if you want to attach any relevant documents, you can simply attach it here, either create it or post the transaction. No duplicate entries, no switching system. Everything stays connected. Now let's see how radiology module works. This is the radiology management module. The workflow feels similar, which means staff don't need to relearn the system, but the purpose here changes. Laboratory handles blood test and pathology workflows, while radiology manages scans and diagnostic reports. Everything remains centralized, structured, and easy to track because diagnostics should support treatment, not slow it down. But once the reports are ready, the next challenge begins: availability of medicines and consumables. Let's deep dive into how MediQuad handles it. This is the inventory management module. From medical consumables to operational supplies, everything is systematically tracked here. The moment we open any item or transaction, you get a full visibility into the movement and availability. No stock confusion, no last minute storage. And finally, the pharmacy management module. This is where medication management becomes seamless. The workflow is similar to inventory but focused specifically on medicines and prescriptions. So, whether it's dispensing medication, tracking medicine availability, or managing pharmacy operations, everything stay connected to the patient's journey. Because hospitals don't fail due to lack of treatment, they fail when departments stop communicating. And that's exactly what MediQuad solves. But now comes one of the most critical part of the entire hospital operations: billing, insurance, revenue cycle management, and lastly, clinical EMR. Because great treatment means nothing if the financial and clinical workflows are broken. And trust me, this is where things get really interesting. So come back next week and see how MediQuad handles this. Thanks for watching.